Reality. Giving birth is deadlier for black women. The CDC finds black women are roughly 3 times more likely to die in childbirth than white women. Healthcare professionals within the Alameda Health System and the Alameda County Public Health Department are trying to stop that raw reality. They call it a crisis, but say it does not have to be that way. That's where beloved Black Birth Centering comes in, giving prenatal and postpartum group care to black women to help them navigate the joys and challenges of pregnancy. Motherhood can be rewarding and sometimes frustrating.
My sleep changed up, definitely.
Sabrina Norsworthy is now a mom of 2. Her newest 4-week-old bundle of joy, Amari, warms her heart. Sadly, worry can too. Sabrina and other black mothers face disproportionate disparities in health care. The CDC finds nationally black moms are 2 to 4 more times likely to die from pregnancy-related causes.
They are quick to hurry up and try and take the baby and do all the cleaning stuff. They won't let you get that real bonding one-on-one time when the baby first come out.
It's weekly check-in time. While this is not Amari's first car ride, it only took one ride for Sabrina to realize she's not alone in her worry.
It's okay.
Throughout her pregnancy and now during early postpartum, Sabrina is among several other black moms at group care called Beloved Black Birth Centering, led for, by, and with black people. This group care focuses on racial and cultural understanding because there's a level of comfort and trust for black moms when their healthcare providers look like them. Access to health care, healthy foods, and adequate housing are factors that contribute to health disparities, too.
They helped me find this place and also helped me with the deposit. So it's just more than just materials. It's more of like a family-based thing, too. Like, they really make you feel like you're part of a whole family.
Sabrina's midwife, Jaisha Wren, created Beloved. She's also a mom.
Beloved Birth Black Centering is absolutely part of this broader birth justice movement, recognizing that it takes this kind of activism, birth justice work in order to address the root cause of these complications.
The root cause of complications? Racism, Wren says. So Beloved is working to cut the cords of racism that leads to complications like postpartum heart failure, blood pressure disorders, low birth weights, among others.
My passion is to be able to see mothers like Sabrina, participants in Beloved who come in, possibly feeling worried about being discriminated against in the care interaction and their health care, possibly being afraid.
They taught me a lot about the medicine that they give newborn babies when they first come out. They taught me the benefits, the health risk.
So with the help of Beloved, Sabrina and her family feels confident in advocating for her rights. And Beloved being the change in how healthcare systems respond to the needs of black moms and their children. All right, so the state even recognizes the disproportionate health impacts among black families. So California's Department of Social Services, it recently awarded $5 million to a San Francisco project called Abundant Birth. I'm told Beloved is excited to collaborate with Abundant Birth to help provide monthly income stipends to pregnant black people to help reduce these racial health disparities. We'll be right back.